Hantavirus pulmonary syndrome, or HPS, is a severe respiratory illness caused by viruses belonging to the family Buneviridae and genus Hantavirus. First identified in 1993, HPS has been documented across North, Central, and South America, although cases of HPS in each region are caused by a different virus. In the United States, most HPS cases are likely caused by the sin nombre virus, which is the virus responsible for the initially identified HPS cases. HPS is a zoonotic disease, meaning that it is a disease that is normally found in animals but can be transmitted to humans. There are 3 identified hantaviruses that can cause HPS, but most HPS cases reported in the United States are caused by the sin nombre virus. It was initially named Four Corners disease due to the fact the initial outbreak of HPS occurred in the Four Corners region of the southwestern United States, where Colorado, Utah, Arizona, and New Mexico meet. The sin nombre virus belongs to the family Buneviridae and genus Hantavirus. Viruses in the Buneviridae family are commonly found in arthropods and rodents. Belonging to this family are single-stranded, enveloped, negative-sense RNA viruses that could potentially cause fatal diseases in humans. Rodents act as reservoirs for hantaviruses. Deer mice are a reservoir for the sin nombre virus and are extremely common in the southwestern United States. As a result, cases of HPS in the United States are most commonly found in the southwestern region of the country. Other reservoirs include cotton rats, which are common in the southeastern United States, and white-footed mice, which are common in the northeastern United States. Hantaviruses are believed to be transmitted by inhalation of rodent secretions, or possibly through direct contact with an infected rodent. However, there have been no cases of human-to-human transmission of hantaviruses in North America. The virus is shed in rodent droppings, urine, and saliva. When rodent habitats are disturbed, their feces and urine can also be rustled, therefore contaminating the air with droplets containing the virus. Humans can then be infected through airborne transmission, where contaminated air is inhaled and progression of the disease occurs from there. This is the most common method of transmission between rodents and humans, although transfer through rodent bite may also occur, but is extremely rare.
HPS has a complex pathogenesis associated with the presence of the infecting hantavirus and intense activation that result in change in vascular permeability. Normal endothelium has tight junction, while the infected endothelium that is infected with hantavirus has gap junctions. This increases permeability, which increases fluid in the lungs. The body attempts to fight the virus by creating inflammation. The combination of the virus infecting various organs and the inflammation created by the body leads to intense bodily damage. The virus causes blood vessels throughout the body to become leaky. In the lungs, leaky blood vessels cause flooding in the air sacs, which causes difficulty breathing, which leads to pulmonary edema. When the virus infects the heart, the damage reduces its ability to pump blood around the body. Failure of the heart to pump leaky vessels with the reduction of blood flow causes very low blood pressure, and oxygen is not available to all the cells of the body. This can rapidly lead to failure of most or all of the organs and can rapidly lead to death. Hantavirus that produce forms of hemorrhagic fever with the renal system cause the classic groups of symptoms including fever, malfunction of the kidneys, and low platelet count. Because platelets are blood cells important in proper clotting, low numbers of circulating platelets can result in spontaneous bleeding or hemorrhage. Patients with HFRS have pain in the head, abdomen, and lower back, and may report bloodshot eyes and blurry vision. Tiny pinpoint hemorrhages called petechiae may appear in the upper body and the soft platelet in the mouth. The patient's fast, chest, abdomen, and back often appear flushed and red as if sunburned. Hantavirus pulmonary syndrome advances through 2 distinct stages. In the first stage, you may experience flu-like signs and symptoms such as fever and chills, headaches and muscle aches, vomiting, diarrhea, and abdominal pain. In the second stage, hantavirus infection is difficult to distinguish from influenza, pneumonia, and other viral conditions. After 4 to 10 days, more serious signs and symptoms begin. They typically include a cough that produces secretions, shortness of breath, fluid accumulation within the lungs, low blood pressure, and reduced heart efficiency. Treatment. There is no known treatment or cure or vaccines for hantavirus infection. However, infected individuals who are recognized early and receive medical care in an intensive care unit have a higher chance for survival. Intensive care patients are intubated and given oxygen therapy to help them through the period of severe respiratory distress, and also blood transfusions are given. Reported cases of HPS in U.S. from 1993 to 2016 are 690 cases. 63% are males and 37% of females are infected. This virus can strike anyone, however. Caucasians currently account for 78% of all cases, American Indians count for 18% of all cases, and African Americans count for 1% of all cases. Cases have been reported in 35 of the 50 United States that are west of the Mississippi River. Out of the 690 cases that are reported, 36% of all reported cases have resulted in death.